For those who have heavy periods, it can be frustrating, painful, and in some cases even, a bit concerning. So please tell me, Dr. Liz, what are some of the causes then for heavy periods?
There's a broad range of causes, so that can include that the uterus itself has some structural things happening there, so fibroids and polyps can cause heavy periods. Also, certain conditions like polycystic ovarian syndrome, where you may not ovulate, and not ovulating can also have a bit of a heavier period. Some people have bleeding disorders, other people may be at, we call it different stages of their reproductive life. So when you're a teenager, and also maybe as you're approaching the menopause, the periods can also be quite heavy. Medical conditions like thyroid problems can also contribute to heavy periods too.
So many things. So what are some of the things that can be done, I guess, to treat them?
There's lots of options. So you can take something simple, providing you're not allergic to certain medications. You could trial something simple like Nurofen, or just an ibuprofen of any brand. There's another medication, non-hormonal, called tranexamic acid. You need a script for. If you wanted to, you could just not have a period. That's really safe. So you can just take your pill continuously if you're on the pill prescribed by your GP, so then you can skip having your heavy periods. Being on the pill will usually lighten your period a little bit too. Some people will be on the mini pill to lighten their period. Other people may take hormonal tablets at the time of the period. And then moving on, there are some surgical options as well.
So tell me, what are the surgical options then? Because obviously you are pretty amazing on this new watch.
There are surgical options which preserve your fertility. So that may include doing a hysteroscopy, so looking inside the uterus, and if there's something that's reversible, like a polyp or a fibroid, we go in and treat that and remove it. Or we can do an intrauterine device, so an IUD like the Mirena, and it can be done in the rooms aside from at the time of a hysteroscopy. And then you've got other options which you can't fall pregnant with, which include an endometrial ablation, so a burn of the lining of the uterus, and that's a day procedure. And then there's a hysterectomy. So sometimes we're lucky with gynecology. If there's a problem with the uterus, if you've completed your family, removing the uterus can resolve the problems with the period. But it's different. Say for example, if you had a heart problem, you can't remove the heart. But with a hysterectomy, there are different ways that we can do that. One's a vaginal approach, one's an open cut on the belly, and then we have what we term minimally invasive techniques, which are keyhole surgery. So there's laparoscopic with sort of straight sticks, which is where we operate and the surgeon opens and closes the instruments in the hands. And then there's the new one now called a robotically assisted total laparoscopic hysterectomy. And with that one, we put the little ports in the belly, we dock the machine, and then the surgeon sits next to the patient, operating a machine that will open and close the instruments, but the instruments themselves are a bit different. They bend and you can operate backwards on yourself, and also there are some other advantages that I see with the robotics, but there's a broad range of options available for the management of heavy periods.
So at this point, who is doing robotics in Cairns?
Currently with gynecology,
You're the only one?
Yeah.
Look at her, isn't she amazing? And you said, if you have to have a hysterectomy now, using the robot, how the recovery is how different is the recovery?
Yeah, it can be different for different people and depends on the reason why you had it and at the time of the operation, the complexities, but usually on average with a robotic hysterectomy, people go home the next day or the day after, and by about 2 weeks they're able to return to work. We get you to avoid really strenuous activity and sexual activity as well for 6 weeks, it's a fairly comfortable recovery compared to the previous sort of open hysterectomies, the previous bigger cuts on the belly there.
How long would that normally take to recover?
It's about 6 weeks from an open cut on the belly.
Wow,
yeah.
It's incredible technology these days, and this lady's all over it. So if your heavy periods are becoming a burden on your life or forcing you to reschedule plans and all these sorts of things, it's time definitely to come and speak to Dr. Liz to consider some treatment options. Thanks for coming in today.
You're welcome.